Hello, I'm Lori Steiner, sitting in for Armin Budish. Welcome to Golden Opportunities.
Today, we'll help heal your bent-over back. Then, have a question about your health insurance claim? We have an appealing answer. You want to contribute to your grandchild's higher education, but at what cost? We'll test your college knowledge. Plus, we all want to look our best. We'll consider how cosmetic surgery can boost your beauty. And little-known tips to maximize your spouse's IRA.
It's time to get geoing, so pull up a chair and join us at our kitchen table for Golden Opportunities. We have an interesting antidote for your aches and pains. So what is this amazing medicine that can work wonders? Merely getting moving. Dr. Noel Aboud is here to prescribe motion for many of your medical maladies. Dr. Aboud is with the Solon Spine and Wellness Center. Welcome back to the show.
Wonderful, thanks.
So movement is actually medicine?
Right. If I had to give just one piece of advice, a good health habit to my patients, I would choose movement. I would say if you could get your body moving, it could solve so many different health problems that we have.
Some examples of the kind of health problems?
We know that it helps create those feel-good hormones when you're moving and exercising. It helps increase your stamina, helps with diabetes, depression, helps with balance. A lot of our elderly patients are having issues with balance, and when you keep moving, it's going to help restore stability on your feet.
Wow, all kinds of things, it sounds like. So, but, you know, if you are already kind of stiff and not being able to move very well,
that's one of the signs that your body needs to move. You know how it is if you have a lazy day on the couch and you get up and you just feel kind of achy? That's when your body really needs to start moving. And that's a sign. It's kind of counterintuitive. You might think, oh, I need to rest more.
Right. You would think that you just have to sit. You'd think it would cause more pain, so I don't want to move. I want to continue to sit here. So when you're talking about movement, what kind of movement are you really talking about?
It could be anything, a walk. Walking is probably one of the easiest, least expensive, readily available activities we can do. And I think that's what we need to do. But it could be gardening, it could be racquetball or tennis or golf. Just move and just get in the habit. I think one of the biggest things is just getting off the couch and getting started, because once we start moving, we feel great. But the biggest issue is getting over the hurdle of putting our shoes on. And so that's what I tell our patients. Just give me 10 minutes, and then it will probably turn into 30 minutes if they just get started.
Now, you specialize in back pain, so how does this kind of movement or exercise affect the back?
Because when your spine isn't moving, you're sending signals to your brain of pain, but when you begin moving, it blocks pain patterns to your brain so you feel better. So we have to restore movement. And we have a saying in our office that says, stiff is old and flexible is young. Let's keep you stiff or keep you flexible and young.
I think you meant the flexible, yes.
Absolutely.
But what if you're already hunched over and shuffling and not really able to move very much? Is there anything that you can do to help somebody get to the point where they can move?
And that's where the vicious cycle is. I feel crummy, so I don't want to exercise and I gain weight. So we specialize, our office, in treating patients with disc injuries, whether it's from spinal stenosis or disc herniation or just arthritis in the back. And we have a specialized machine called non-surgical lumbar decompression, and it creates like a vacuum, and it draws blood into the disc, and it helps that disc regrow and regenerate to some degree. And when we can do that, that allows the nerves to flow. You start seeing the patient begin to stand up straighter. Their gait is no longer that shuffling gait. So those are the kind of conditions that we typically treat in our office.
How many treatments do you really need to see a difference?
That's what we want to determine, and what we've decided is to make our office unique. I want to sit knee to knee with our patient, review their MRIs, their x-rays, hear their story. I want to feel their spine, and then I can at least let them know if I can help them. I won't waste their time if I can't, but if I can, we'll sit down and spell out how long it would take to help them.
All right, so it's this kind of a treatment is exercise without actually having to exercise, getting you ready to actually do that real movement outside on your own. So
absolutely.
Sounds really good. Dr. Aboud's advice to get moving really is quite moving. Help your health by putting his pointers into practice. And for more healthful hints, give them a call. The number is next.
Learn more by calling Solon Spine and Wellness Center at 440-941-9331 or log on to www.solonbackpain.com. Next, name it to claim it.